The threat and risk of chemical, biological, radiological, and nuclear CBRN weapon use increased in the Middle East region with the escalation of the military situation in Syria, starting in 2012, both in Syria and neighboring countries directly affected by the massive refugee influx. Improving the capacity of health staff in terms of managing potential exposure to chemical hazards while ensuring staff protection and health facility safety became an urgent matter. The World Health Organization, Lebanon, had started in 2012-2013 the normative training of CBRN for Lebanese health staff, reaching a critical mass of 222 hospital professional staff on clinical management concepts of CBRN, with preliminary training on personal and environment safety issues. A similar training was organized by WHO Lebanon for hospital staff from Syria in coordination with WHO Syria office, reaching a total of 11 professional health staff working in Syria. In February 2014, a simulation exercise for decontamination and clinical management of casualties exposed to chemical hazards was organized jointly between WHO Lebanon, WHO Syria, and WHO headquarters under the International Health Regulation Program. The training simulation was held at the St. George Hospital's Lebanese European Academy of Emergency Medicine. Two main objectives were set for the simulation exercise. First, strengthening chemical emergency response through providing advanced theoretical and practical training on protecting medical responders from secondary contamination from toxic chemicals. Practice international standards for triage, decontamination, and life-saving interventions using personal protective equipment. Second, developing national trainer capacity through learning the strength and limitation of personal protective equipment, PPE, learning key training techniques from international experts, developing a basic training course for Syrian responders in designated Ministry of Public Health, Ministry of Higher Education hospitals.
A bit of water going in, they might need an airway, just someone there controlling that, who's got control of the patient is the doctor.
The training included lectures on the following subjects: chemical risks, management of blast injuries, improvised explosive device injury management, chemical incident triage, and PPEs.
And toxic chemicals come together.
The training concluded with a half-day comprehensive field exercise where participants worked as part of the St. George Hospital response team, including a mobile response team, vehicle decontamination teams, and evaluators. The simulation scenario was constructed for a mixed trauma and vesicant agent signs and symptoms case. Activities required by the course participants included receiving patients, triage, ambulatory, non-ambulatory decontamination, life-saving interventions, and self-decontamination, as well as assisted and unassisted doffing of personal protective equipment, PPE. The specific procedures of the St. George Hospital provided the opportunity for the participants to identify key issues to consider in their own setups when back in Syria, such as contingency planning, communication, and coordination. At the end of the training, participants identified areas that needed further reinforcement, including training, healthcare workers, master trainers, institutions, equipment, PPE, antidotes, triage. Response plans for the participants' respective institutions will be developed accordingly. Finally, and since the training conducted in Lebanon in February 2014, the Ministry of Health in Syria has established a core team of trainers with WHO, a core team of trainers with World Health Organization. These trainers have rolled out the training at the governorate level in Syria.